Afternoon, everyone. My name is Solome Okware. I work with the Ministry of Health. I feel like I'm short. I work with the Ministry of Health in the in the Emergency Operating Center. Okay, so basically a space where emergencies in Uganda are coordinated and surveillance information feeds into. Yes. I'm currently part of a project that is supporting the implementation of the National Action Plan for Health Security, which was launched last week on Thursday. And it's very interesting for me that we are talking about partnerships and I haven't heard anything about it. So this is a very interesting meeting for me. I will be speaking about leveraging Ebola viral disease emergency preparedness for universal health coverage. Okay. As you are aware, in 2018 in August, the DRC notified WHO about an Ebola outbreak. It was in North Kivu. A few cases had been identified, which now have turned into the second largest outbreak that we have ever heard of. In response, Uganda stepped up their emergency preparedness activities. Now, for those of you who don't routinely deal with outbreaks, emergency preparedness simply means that you are activating within the system checks and balances that allow you to detect early, to respond quickly, and to recover from whatever is happening. It also gives a chance for you to anticipate almost what exactly is going to happen. Yes. There has been a lot of talk of recent of looking at the symmetry between what we do for emergency preparedness and what that means for universal health coverage. And I think that is what my talk is going to focus on. Sorry for the small picture. In 2018, WHO released their general program of work for the next 5 years, and they identified 3 big targets. 1 was the healthier populations, 2 was preparing for health emergencies, and the 3rd was universal health coverage. All represented as 3 circles with areas of interconnectedness, but not clearly. So what this focuses on is how do we expand that central area of interconnectedness so that we can benefit from the partnerships that already exist in public health emergencies and expand it into universal health coverage. So the objective was to assess the potential effects of emergency preparedness for Ebola viral disease on the health system strengthening and its potential to impact on universal health coverage. This was mainly a desk review, policy documents, assessment reports, several accountability fora reports for the meetings that have been held since the outbreak started, and then the general SOPs and guidelines that support this process. We looked at what the functional pillars are in Ebola preparedness. That's coordination, case management, logistics, surveillance, social mobilization, and psychosocial support. Tried to see how it connected to the health system building blocks, the leadership, the healthcare, then financing, medical products, information, and research, and then service delivery, and then try to see how that would match to universal health coverage. I must admit that for this particular assessment, we tried to keep away from the maternal and child health, so you will not see those connections in the presentation. What we found was preparedness efforts are based on risk, and they're spread across the entire country, bringing in some sense of equity in whatever we are doing. But then also that for most of the preparedness activities that are started within the government, everything is focused on the public health facilities, very little in the private health facilities, which means that all the resource that you would have garnered from that private sector, whatever they could pull in terms of resource, in terms of their mobilization activity, whatever it is just kept out of this. But it also reflects, I think, a little bit on how we look at the private sector and how we look at the public sector. We also found that capacity building efforts were geared towards all the pillars within the Ebola viral disease functional pillars. So there is effort put into coordination, there is effort put into case management, surveillance, risk communication, vaccine. But what that means for the health system is that we are improving service delivery. We are improving on workforce development. We are improving on possible financing and leadership and governance and health information systems. By strengthening the coordination function just for outbreaks, for public health emergencies, what we are doing is strengthening the leadership and governance, particularly at the district levels, because they have to respond to these public health emergencies. We also found that overall stewardship is provided by the national task force. And at the district level, it's a district task force. It is a multidisciplinary, multi-sectoral committee that looks into how we should respond to an outbreak. What exactly should we do? So in that framework, you already have the health sector represented. You have representation from the political leadership at the district level particularly. You have representation from partners. You have a lot of representation, so a space to coordinate. Yes, and do resource mobilization. Then workforce development targeted, again, as I already said, surveillance and patient care. I think this is one of the biggest areas that we are not leveraging on. We have boxed into several parallel systems where you improve the provision of something for an emergency, but it does not translate into the same for routine care. Then also training of such capacity staff supports the adaptability for acute events. Another important finding is that we have something called community-based surveillance, which is enhanced through training of village health teams and community leaders, which means that they are now responsible for whatever health outcomes they have. So you've created another level of governance, not just at the national level, not at the district level, but even at the community level, where they feel empowered to report on what is happening in their society and also to have the authority to do something about it. There was also deployment of vaccines for the first time during this outbreak. Again, it improves the cold chain capability for routine immunization, and surveillance improves overall targets. In conclusion, I think emergency preparedness strengthens the health system and has a potential to influence on universal health coverage. I will leave it as potential because as we work in silos, a lot of the interventions that are done for public health emergencies are for during that public health emergency. But if we leverage on those partnerships and do not plan in silos, what we are doing is potentially creating a way to finance, in a way, the public health system. Also, it supports the adaptability of the health system. I think in West Africa, one of the things that was noted as to why there was this protracted, long outbreak of EVD was because the health system just could not adapt to what was happening. So in supporting it in this way, we are actually creating a stronger health system that should be able to respond not just to public health emergencies, but to the needs of universal health coverage. It also expands the pool of resource and technical assistance, but without engaging the private health sector, we are leaving out a huge part. And finally, we should support the sustainability of these efforts. I put this cogwheel up here to not replace the Venn diagram that had been put up by WHO, but simply to show that all these things are working in tandem. And simply by pushing one, we are strengthening the entire system, strengthening the governance in the entire system, strengthening accountability in the entire system, and leveraging on what is already present for a bit more. Yes. Thank you very much.
Thank you very much, Solome. I think that's a wonderful experience you have given